Here's a number that stops most people cold. If you retire before 65, health insurance alone could cost you $20,000 to $30,000 a year out of pocket before Medicare ever kicks in. And here's the frustrating part. Most people who are financially ready to retire don't. Not because the portfolio isn't, not because the math doesn't work, but because they log on to the insurance marketplace, see the numbers, and quietly go back to work. Today, we're fixing that. 5 options, real numbers, and one tax strategy that most financial videos skip entirely. Let's get into it. The gap. Medicare starts at 65. No exceptions, no early enrollment. The average American retires at 62. That means there's a gap, sometimes 3 years, sometimes 10, where you are completely on your own for health coverage. Think of it like a bridge you have to build yourself between your last paycheck and Medicare. The question isn't whether you need the bridge. You do. The question is what you build it with. You've got 5 materials to choose from: COBRA, ACA Marketplace plans, private insurance, health sharing ministries, and the part-time work strategy. Each one fits a different situation. By the end of this, you'll know exactly which one fits yours. And if you're enjoying the video so far, make sure to hit that like button and subscribe to see more videos like this. COBRA. The first thing HR hands you on your way out the door is a COBRA packet, and most people sign it without thinking twice because it's the same plan, same doctors, same network. Familiar. The problem is the price tag. In 2026, COBRA runs $400 to $700 a month for an individual and $1,200 to $2,000 a month for a family. That's not a typo. Here's why it's so jarring. Your employer was quietly covering 70 to 83% of your premium the entire time you worked there. COBRA just removes that subsidy, all of it, plus a 2% administrative fee on top. Here's a trick almost nobody knows. Look at your W-2 Box 12 code DD. That number is your actual annual health plan cost. Divide by 12. That's your COBRA bill. Do this before you retire so you're not blindsided. COBRA does make sense in specific situations if you've already met your deductible and have procedures coming up, if you're retiring late in the year and only need a few months of coverage, or if you're within 18 months of turning 65 and just want to ride it out to Medicare. One underrated risk, though. If your former employer changes or drops their plan entirely, your COBRA goes with it, even mid-coverage. Worth knowing before you depend on it. ACA Marketplace. So you decide to skip COBRA and shop the marketplace. Smart instinct. But 2026 just changed the rules in a big way, and most people don't know it yet. The enhanced subsidies that were put in place during COVID expired on December 31st, 2025. The subsidy cliff is officially back, and it's steep. Here's what the cliff means in plain numbers. A 60-year-old earning $62,000 pays around $515 a month in premiums and qualifies for help. The same person earning $64,000 pays $1,244 a month with zero assistance. That's not a gradual increase. That's a wall. $1 over the income limit and you lose every dollar of subsidy, all at once. For couples, in 2026, the cliff sits at $84,600 of household income. For a single person, it's around $60,240. According to KFF, average annual premiums for subsidized enrollees more than doubled from $888 in 2025 to $1,904 in 2026. That's the world we're in. If your income stays under those thresholds, ACA plans can still be very competitive. The plan tiers break down simply. Bronze means low premium and high deductible, good if you're healthy and rarely need care. Silver unlocks extra cost-sharing reductions if your income is low enough, making it the best value for many early retirees. Gold means higher premium but lower out-of-pocket costs, better if you use healthcare regularly. The key is matching the tier to how much care you actually use, not just going for the cheapest premium. One warning that could save you from a nasty surprise: if you take advance premium tax credits during the year and your income ends up higher than you projected, you owe that money back at tax time. Financial planners are already calling 2027 tax season the year of astronomical repayment bills. Estimate conservatively. The MAGI strategy. This is the part of the video where things get genuinely useful and where most other videos stop short. Your ACA subsidy is based on MAGI, your modified adjusted gross income, not your net worth, not your account balances, just what counts as taxable income in a given year. And for early retirees, that number is largely in your control. If you have money in Roth accounts or regular savings, spending from those sources doesn't count as income. It doesn't add to your MAGI at all. Traditional IRA or 401k withdrawals do count, so the order in which you pull money matters enormously. HSA contributions reduce your MAGI dollar for dollar. In 2026, that's up to $4,400 for an individual and $8,750 for a family. Capital gains from selling investments count too, so if you're planning to rebalance or sell appreciated assets, the timing of that relative to your marketplace enrollment year makes a real difference. Roth conversions are the one to be careful with. They count as MAGI and can push you over the subsidy cliff in a single move. The strategy is to do your Roth conversions in years when you're not relying on ACA subsidies. Maybe you're on COBRA or on a spouse's plan, and then manage your income carefully in the years you need the marketplace to work for you. This is exactly the kind of planning that's worth sitting down with a fee-only financial planner. The savings can easily run into 5 figures over a few years. Private plans and health sharing. Now, here are 2 options that don't get nearly enough attention. The first is private non-ACA insurance, short-term and extended-term plans from carriers like United Healthcare's Golden Rule. These plans often cost significantly less than unsubsidized ACA plans, and in many cases give you access to large PPO networks. The catch is medical underwriting. Unlike ACA plans, these carriers can ask about your health history and deny you coverage based on pre-existing conditions. They're also not required to cover preventive care, maternity, or mental health the way ACA plans are. But if you're healthy, have no major ongoing conditions, and your income is above the subsidy cliff, a private plan can save you thousands a year. One important note: some states, including New York, don't allow individuals to buy these plans at all, so verify what's available in your state before counting on this option. The second option is health sharing ministries, and this one requires you to go in with eyes wide open. These are not insurance. They are faith-based pools where members contribute monthly and share each other's medical costs. Monthly contributions can run as low as $115 to $315 for an individual, which sounds appealing, but they are not regulated like insurance. They are not required to cover pre-existing conditions or mental health care, and if a claim gets denied, you have very limited legal protection. Most have lifestyle requirements: regular church attendance, no tobacco, a statement of faith. For a very healthy person who understands exactly what they're buying and what's excluded, it can be a cost-saving bridge. For anyone with existing conditions or expecting predictable coverage, it's a high-risk bet. Go in knowing the difference. Part-time work strategy. Here's the option that sounds the least glamorous, but is actually one of the most financially elegant. Some companies offer health benefits to part-time employees. Starbucks, Costco, Trader Joe's, REI, and UPS are the most well-known examples. The idea is simple. Rather than paying $1,500 a month for coverage out of pocket, you work 20 to 25 hours a week at one of these employers and let the benefits come to you. The math holds up. Working 20 hours a week at $18 an hour brings in roughly $18,000 to $19,000 a year. If your employer covers even half of a health plan that would otherwise cost you $15,000 a year, you're coming out ahead, and you have income to show for it. There's also an angle people miss. That part-time income can actually help you stay in the MAGI sweet spot for ACA subsidies, turning a job into a dual tool, income and cheaper coverage at the same time. And beyond the money, there's real value in having structure and routine, especially in the first few years of retirement when going from 50-hour weeks to zero can feel more disorienting than freeing. Always verify benefits eligibility before you rely on this. Company policies change, but if it fits your personality and timeline, it's one of the cleanest solutions on this list. Decision framework plus close. So here's how to think about which option is actually right for you. If you're within 18 months of Medicare and have ongoing care needs, COBRA is probably your bridge. If your income is below the subsidy cliff and you have flexibility in how you draw from your accounts, the ACA Marketplace with strategic MAGI management is your best tool. If you're healthy, above the income cutoff, and in a state that allows it, a private plan is worth a serious look. If you're open to part-time work and want coverage plus structure, the employer benefits route solves two problems at once. And if you're married with a spouse still working, that's the option we didn't spend much time on, but it's the simplest one of all. Join their plan. It's often the cheapest move on the board. Start this planning 12 months before your target retirement date. Talk to a fee-only financial planner about the MAGI strategy. Talk to an independent insurance broker not tied to a single carrier about your actual plan options. Run the numbers for your specific age, income, and state. Health insurance before Medicare is a real cost, but it doesn't have to be the thing that keeps you at a job you've already mentally left. You have more options than you think. Now you know what they are. And if you want to learn more on retiring, make sure to watch this video.